Hey guys, and welcome back to ESH MedEd. Today we're going to be going over SBAR. SBAR is a technique that we like to use when we're performing a handover over the telephone to a senior or other member of staff. SBAR is a way to keep the information that you're trying to get across concise and in a structured way so that the person on the other end of the phone call can understand what's going on and be able to feed back to you what you need from them as quickly as possible. Now, SBAR can be broken down into situation, background, assessment, and recommendations. Situation is who you are, where you are, who you're calling about, and why you're calling. I'm going to go into an example with this in a minute. Background is why the patient is here, how the observations have changed, the last set of observations, and if appropriate, how the patient is in their day-to-day lives. Next up is the assessment. So that's what you've done since you've turned up, the results of that, what this means you think it is, and what you've done to try and rectify the situation. Recommendations is what you need from them. So that's whether you need them to come see the patient, whether or not you need them to organise a surgery, and whether or not there is anything else that you can do in the meantime. Now that I've explained what SBAR is and how each section of SBAR relates to the patient and the situation that you're in, we're going to work through an example. Hi, is this the MedReg on call? I'm Dr. Smith, the F1 on the A&E ward. I'm calling about a patient, Mrs. Green, a 35-year-old female, because I'm concerned that she may be going into septic shock. She came into A&E feeling a little bit unwell and with a high temperature, and she's been feeling short of breath for a couple of days now. When I listened to her breathing, she had crackles on the right base. The last set of obs that I took for her, she had a respiratory rate of 32, her SATs were 98% on 15 litres of oxygen, and her heart rate was 144, and she had a blood pressure of 82/43, and her temperature was still 39.4 degrees. She doesn't have any past medical history, isn't on any medication, and doesn't smoke, and has no known drug allergies. I took an ABG, which has come back with quite a high lactate. Her bloods, when they came back, showed a raised white blood cell count and a raised CRP. I also ordered a chest x-ray that has shown consolidation on the base of the right lung. I've given her oxygen and 1 litre of fluid so far, and I've also started her on broad spectrum antibiotics, and the patient has just been catheterised. I was wondering if you can come and see her as soon as possible, please, and is there anything else I can do while I'm waiting for you to come down? Now let's break that down. So, the situation on that was I was explaining that I'm Dr. Smith, the F1, and I was on the A&E ward. I told the MedReg on call that I was calling about a patient called Mrs. Green, a 35-year-old female, that I was concerned about because she may be going into septic shock. I then moved on to the background. I explained that she came into A&E, she wasn't feeling great, and she's been short of breath for a couple of days, and when inspected, had crackles on the right base. I then went on to explain what the last set of observations were and her history before coming in with this issue. I then moved on to an assessment, which is what I'd done already and what I thought that meant. So I explained that I'd got an ABG, bloods, and chest x-ray, and all of them had hinted towards pneumonia that had been leading into sepsis based on the observations. I then explained what I'd done in response to this, so giving the oxygen, the litre of fluids, and starting the antibiotics, and also getting the patient catheterised. Then I moved on to recommendations. That is, that I asked the MedReg to come down and see the patient and what I could do before they got there. Now, if I gave that again and I didn't use this structure, I could be all over the place saying that I've got a patient here who's got a respiratory rate of 32 and a blood pressure of 82/43. I think they might be going into sepsis. The chest x-ray showed consolidation, but she also has a high temperature. I don't think she's got any known drug allergies, and I've given a litre of fluids to try and combat the blood pressure, and I want to know what they want. The way I've explained that there is a lot more jumbled and will take the MedReg a lot longer to think about the information that I've given them before they can formulate a response and they can respond to the recommendation that I've requested. In conclusion, SBAR is a very helpful tool that allows you to create a concise and structured format to relay information to your seniors and other members of staff so that you can get their recommendations of how you can further help your patient as quickly and efficiently as possible. One more tip for when you're calling your seniors is it can be quite difficult to remember all the information required to give an effective SBAR, so don't be afraid to take your notes with you that has all that information on it.